Right, this is Shalisa Grimes. This is my video essay on C. diff. Okay, so we have the introduction page, and then next is the etiology. The bacterium is Clostridioides difficile. It's gram-positive bacteria, bacillus shaped. It's an obligate anaerobe. It's usually found in water, air, human and animal feces, hospital surfaces, and soil. It requires 37 degrees Celsius to grow and is transmitted via fecal or oral route. It primarily occurs after use of antibiotic medication. So what that means is someone that misuses antibiotics, someone that gets prescribed antibiotics that they don't really need, or they take it for a long period of time, you can become susceptible to C. diff. Pathophysiology. So the bacteria colonizes in the humans within the large intestines. The misuse of antibiotics shifts the microbial flora within the large intestines, which makes the intestines vulnerable to C. diff. Features of C. diff are colitis and diarrhea, which is caused by Clostridial glycosylation exotoxins. And there are two types of toxins for C. diff: toxin A, which is enterotoxin, and toxin B, which is cytotoxic. Both of them have similar mechanisms as their action, but most of it is carried out by toxin A. So after toxin A creates a way for both of them and they become intracellular, both the toxins inactivate the pathways arbitrated by the Rho family of proteins. This causes damage of colonocytes, interference of tight junctions, and colitis. Signs and symptoms. Symptoms usually occur within 5 to 10 days after use of antibiotics. You will have extremely watery diarrhea, which is 3 times a day or more than 1 day. 3 times a day, more than 1 day. Mild abdominal cramping and tenderness. When you have severe C. diff, you will probably develop colitis and raw tissue patches that can bleed or produce pus. This also includes watery diarrhea, but now you're doing 10 to 15 times a day. Abdominal cramping and pain, rapid heart rate, dehydration, of course, from diarrhea, fever, nausea, increased white blood cells, kidney failure, loss of appetite, swollen abdomen, weight loss, blood or pus in the stool. Diagnosis. Usually the doctor will take a stool sample, or they will do a colonoscopy or sigmoidoscopy, an x-ray or CT scan, which is normally just to see if your large intestine is inflamed. So when they get the stool sample, they may do a culture of the bacteria. And so the sample can be placed on a petri dish, incubated overnight anaerobically at 37 degrees Celsius. Then you will add 333 of 50% glycerol and 66 of C. diff culture to a 1.8 milliliter cryogenic tube to create a 15% glycerol isolated strain. So that's how you would get the cultures of C. diff. And if you want to get it isolated, you would go through those steps. For treatment, there are two main antibiotics, vancomycin and metronidazole. I'm not good with medications at all, and I work in the healthcare field. But anyway, vancomycin and metronidazole may be used together if C. diff is serious. And also, there may be some surgery required if the affected area or the disease is just focused on one area of the large intestine. So they might have to do surgery to remove that disease area. In order to prevent C. diff, early detection is the best. Like I said, if you have diarrhea 3 times a day, then that's one sign, which is something unusual. And once it is detected, isolation and precaution sign in healthcare facilities is required. And also, if you're out at home, isolate yourself and, not really put up a precaution sign, but let people know, what's going on. And practice good hand hygiene. This goes inside the healthcare facilities because sometimes we get busy with patients going from room to room, may just do a little hand sanitizer and go on by the day. But with C. diff, you have to wash your hands with soap and water. Whenever you come in contact with a person with C. diff, you have to wash your hands with soap and water. And also good environmental cleaning, which can go both ways, in home and in hospital setting or a healthcare facility. Um, and that just concludes my PowerPoint. Thank you.